Hi friends, I've brought in a video for you. This video is going to be on Ironone Capsules. Ironone Capsules contain Polysaccharide Iron Complex 150 mg in every capsule. The box has 30 capsules in it. It's made by MohammadThePharmacist. The price for one box is 423 rupees. Iron fumarate, ferrous gluconate, ferrous sulfate is used to treat or prevent anemia, a lower than normal number of red blood cells. Iron deficiency anemia is a common type of anemia that occurs if you do not have enough iron in your body. People with mild or moderate iron deficiency anemia may not have any signs or symptoms. More severe iron deficiency anemia may cause fatigue or tiredness, shortness of breath, or chest pain. If your doctor diagnoses you with iron deficiency anemia, your treatment will depend on the cause and severity of the condition. Your doctor may recommend healthy eating changes, iron supplements, intravenous iron therapy for mild to moderate iron deficiency anemia, or red blood cell transfusion for severe iron deficiency anemia. You may need to address the cause of your iron deficiency, such as any underlying bleeding. If undiagnosed or untreated, iron deficiency anemia can cause serious complications, including heart failure and development delays in children. When the amount of iron taken in from the diet is not enough, iron supplements are used. Iron is a mineral that is available as a dietary supplement. It works by helping the body to produce red blood cells. Iron is usually taken with food or immediately after a meal once daily or as directed by your doctor. Take iron at around the same time every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take iron exactly as directed. Do not take more or less of it, or take it more often than prescribed by your doctor. Iron supplements are available alone and in fixed combinations with vitamins and certain medications. If your doctor has prescribed a medication that contains iron, you should be careful not to take any other supplements or medications that also contain iron. Swallow the tablets. Film coated tablets and extended release tablets whole. Do not split, chew, or crush them. This medication may be prescribed for other uses. Ask your doctor or pharmacist for more information. Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. Iron supplements may cause side effects such as constipation, stomach pain, diarrhea, nausea, stain teething, etc. Iron supplements may cause other side effects. Call your doctor if you have any unusual problems while taking this medication. I hope you liked the video. Please like and share our channel. Subscribe to our channel. Thank you.